Hi, everyone. This is Dr. Zeus Yamianis, PhD, also known as Citizen Zeus in my activist role and trying to bring knowledge and to bring things together that slip through the cracks. My specialty is critical media literacy, and I also have a science background in biology and worked in a physiological chemistry lab as an undergraduate. So I have a grasp of scientific knowledge. My PhD is in philosophy of education, and I got basically grounding in the philosophy, sociology, history, anthropology, psychology, etc. of education, and particularly the cultural foundations of education. So what I'm able to do is combine that science knowledge with an understanding of critical thinking and a broad understanding about how culture works and media works to develop both a scientifically informed and critical media understanding to help you understand and read the news as well as understand it. So that's my idea. That's what I'm really trying to bring forward in this whole series on COVID-19. This video will be part 2 of a series of videos I'm doing to meet questions that people have. The first part had to do with, does vitamin D and C work, as some of these more homeopathic or naturopathic people are talking about. I showed that it did, and the peer-reviewed articles indicated that it does work to address disease, immune problems, and shows great promise and correlation for helping COVID-19, and has been used on COVID-19 patients in other countries, though of course the research is still preliminary, but it's very promising. So, so that's that. In this video, I'm going to talk about this surprising understanding that smokers were underrepresented among COVID-19 mortality or death rate. In other words, smoking seemed to actually help COVID-19 patients, and it doesn't make any sense. If it's a respiratory syndrome, smoking is one of the worst things for your heart and for your lungs. How could smoking help? Turns out, I'm giving away a little bit, but I'm going to talk about this, that it's the nicotine in the cigarettes that was binding to sites that the virus was binding to, displacing them and preventing them from getting in the body, kind of camouflaging themselves and replicating. That was really what the cigarette smoking was doing. I think France had to kind of put a limit on people's buying out the stock of nicotine patches, because obviously if you get rid of the smoke and you just go to the nicotine, it's going to be much more preferable than taking it through with smoke when you have a respiratory distress. So the smoking itself was not helping, but the nicotine was binding to some of the sites that the COVID-19 virus was apparently binding to, and that was what was causing the issue. We'll talk about that. We'll also talk about cytisine, which is a natural replacement of that. And we're going to go forward and talk about some of these other issues that stem out of here. Let me go ahead and get to the corner, and I'm going to go ahead and summarize briefly what I did in the other video. Part 1, we talked about vitamin D and that it does appear to regulate and repair pathological or overactive immune responses. We talked about the ways it did that, and we also talked a little bit about vitamin C. Appears to do this as well, and even talked about some of these studies and even clinical interventions that Chinese and South Korea were doing. And again, I have all of these references in the body of the message, so you can look any of them up. Sometimes I don't have enough space to show what exactly it is, but I have enough space for the URL. So in this one, part 2, we're actually going to look at nicotine and natural analogs like cytisine, which appears to compete effectively with COVID-19 virus in binding to receptors that allow viruses to enter cells, especially the lung, lowering the access of COVID-19 virus to your body. And nicotine and other analogs like cytisine, these are called the cholinergic response, ameliorates central nervous system inflammation by inhibiting overreactive T cells, okay? So again, when I was talking about it being a nerve disease, in the other one, a blood nerve disease. Now we're talking a little bit more about the blood in connection with nerve. The fact is, we have a nervous system that modulates our hormones and affects our blood. You know this by the time when you actually get nervous and anxious and you crank up, you basically flood your body with certain kinds of hormones which get keyed up. And if it's really, really like keyed up, or if it's like a surprise, or you'll get an adrenaline put into your system and so forth and so on. So this system, you have what's called a sympathetic nervous response that keys you up. And then you have a parasympathetic response that helps bring you down. You find this in every one of these systems. We have pro-inflammatory antibodies or responses, cytokines, that key your body up and key your immune system up. And then you have anti-inflammatories that bring it down. And the two of these play to create some kind of regulation. When it's off, you have an overaction of one, which can eat up your body, and just like stress can eat you up. And if you have an overaction of the anti-inflammatory, you don't have enough. You're lethargic. You don't have enough response. You can easily be victimized by, say, a foreign protein. Every place in your body has this. Antibodies, we already talked about that in another video. We have what's called binding antibodies. And you have these things called neutralizing antibodies, where these neutralizing antibodies go in and help reduce and neutralize this thing, where these binding antibodies actually crank everything up. And in cranking things up in an uncontrolled way actually can help the virus both replicate and do more damage. So much of what we're learning here is how the system itself, our systems, are under our control. Emotional control, diet control, being very careful and comprehensive about the research that we pay attention to and the drugs we take, including the supplements and so forth we take. Not just listen to somebody, but understand the underlying mechanisms of these things. We will do a lot better to understand our health. This video is not just about the narrow issue of how nicotine works or doesn't work, or vagal stimulation, exercise, and mind-body, which we'll get to help create this balance between keyed up sympathetic nervous system and keyed down parasympathetic, or keyed up production of cytokines, inflammatory cytokines, or keying down of anti-inflammatory ones. It's really about understanding the factors that allow us to create an equilibrium between these forces so they can do what they're supposed to do. That's a more comprehensive approach. So we'll look a little into vagus nerve stimulation, exercise, and mind-body training, which also, along with these other things, play a role in the cholinergic system, with allowing the parasympathetic nervous system to kick in to bring down a keyed up nervous response. So since these all are related, that's why I'm calling COVID a blood nervous disease, a blood nerve disease, because so much what's involved in here is emotional reaction. And one of the greatest disservices that's been happening with our media right now, and you saw it happen with 9/11, they just had those planes going into the building over and over, creating repeated trauma, repeated anxiety, repeated messaging, but you could just die or kill and walk out and, it'll be all over. That is a huge risk factor. Flooding your body with these kinds of energies, with these fight or flight hormones, is going to disable your immune system. You have to be smart about this. Like I said in the other one, what is the opposite of the three main things they're throwing at us right now? The opposite is this. What they're throwing at us right now is fear, ignorance, and opportunism, okay? Fear by the media, ignorance by a lot of religious and sometimes conspiracy community and people as well. And then a lot of opportunism by big pharma and drug companies to just use our trauma to make a buck. The opposite of fear is courage. Courage. Look at what's happening to you. Take the time to go outside. Take the time to really not be thrown in, which has its own problems. Use smart best practices in doing that. And that goes in the second one. What's the opposite of ignorance? Knowledge. Take smart risks if you're going to take them. Take the time to do the research and see if vitamin D and C work like I showed you in the last video. And see why. Don't just take somebody's word for it. Make your own decision. This is never, what I do to you is never a medical recommendation. It's always something you have to take in, you have to feel for yourself, and you have to do your own research. And finally, what's the opposite of opportunism? Care. I'm doing these videos because I care about you, I care about the truth, and I care about a more extensive understanding of these things. When you instead of having to do it all yourself, I figured I will take the time to integrate some of this for you. Like I said in the other thing, the conclusion is that we have to take these on and comprehensively look at the science, connect the dots with a conviction toward arming you and each other, the person on the ground, with good information and a healthy, successful ways forward. So let's embark on this. It's an interesting journey. The new scientist comes out and says smoking probably puts you at greater risk of coronavirus, not less. This was again in May 19th, just a little while ago. Even though their studies have been done on this, I put it out there just to show you how to look at the language. First of all, look at all the things here that they're getting wrong. It says cigarettes seem an unlikely ally against a respiratory virus. Yes, they are. Cigarettes, tobacco smoke damages the tiny air sacs in the lungs where oxygen enters the blood and slows down the hair linings. The hairs lining the body's air passages that gently waft along mucus. Exactly right, we already know that. But we also know from part 1 of this video that it's not primarily a respiratory virus, it's a blood and immune system virus that is creating clots in the lungs. And it really doesn't matter in some ways if it's damaging some of the air sacs. That clotting is doing far greater damage to it. And the nicotine in that cigarette is alleviating some of that clotting damage by neutralizing some of the sites, or by occupying some of the sites that would be occupied by the virus. They don't talk about that, and they should at least have acknowledged that. Smokers are affected more severely from colds and flu. This is not straightforward flu, remember. It's a SARS virus grafted onto one that is a blood virus with a gain of function. With an HIV-like. If it's not an HIV insertion, like the conspiracy community is talking about, it's very HIV-like in the way it has of infecting. So we've basically grafted a respiratory virus on with a blood virus, and it has kind of the worst of both worlds. So you can't just look at one or the other. And years of smoking can lead to a type of emphysema or chronic obstructive pulmonary disease. Cigarettes are bad for you. We know that. They're bad for your heart even more than your lungs. And they have their own class of problems. But then it says, but data emerging from the countries first hit by coronavirus gave doctors pause. The proportion of smokers among those being hospitalized for COVID-19 was lower than in the general population. In China, for instance, about 8% of people in the hospital with COVID-19 were smokers, while 26% of the general population smoked. That's more than that's basically more than 3 times as much. The equivalent figures for Italy were 8 and 19%, respectively. Smokers, less than half. Non-smokers, very similar in terms of percentages. The data seem to be repeated in different countries, says Alberto Najera at the University of Castilla-La Mancha in Spain, whose team analyzed figures from 18 of the first such reports. He says nicotine may reduce the immune system's tendency to overreact to the virus and cause a cytokine storm, an inflammatory response that can be deadly. Just like we saw with vitamin D, and I bet you, though we didn't explicitly point for it in vitamin C, it seems like there was some tangential relationship of vitamin C to that anti-inflammatory response. Nicotine had that as well. So let's go ahead and look forward on this one. So this is in The Economist. This is where I actually found out about this. Smokers seem less likely than non-smokers to fall ill with the COVID-19. And here's the relevant passage here, okay? Nicotine is not thought to attack SARS-CoV-2 directly. It may, however, play an indirect role that involves a cell membrane protein called ACE2, to which the virus attaches itself in order to gain access to a cell. Some researchers suspect that the nicotine binds to the ACE2 as well, and that this makes it harder for the virus to do so alongside it. So basically, nicotine's out-competing where that virus would hook into your cells, and so the virus, it doesn't have as successful a rate of entry into your body and into your cells. Nicotine may also soothe inflammation caused by the infection, a hypothesis supported by its use to treat inflamed bowels. Just like vitamin D, it has an anti-inflammatory effect, apparently, and has been used, or nicotine has been used to treat inflamed bowels. That inflammatory effect, those multi-organ inflammatory syndrome you saw in kids, all those things also can be somewhat addressed by nicotine, apparently. Now, this is just a conversation. It's it's a popular understanding. It says, does nicotine protect us against the coronavirus? And again, these are the authors that they're talking about in the study. Found 4.4% of inpatients and 5.3% of outpatients with COVID-19 were smokers. That's only 1/20th of the population after adjusting for differences in age and sex. So they already adjusted for those. This is only a fraction of the prevalence seen in the general French population. Some 25% reportedly smoked daily in 2018. So something about this suggested that, 5 times as many people reportedly smoked, and there were 25% smoked, and only 25% were represented among these really dire cases of COVID. The authors asserted current smokers have a very much lower probability of developing symptomatic or severe SARS-CoV-2 infection as compared to the general population. Does it mean we run out and go start smoking? No, we begin to figure out what it is in the smoking that goes ahead and does it. The finding of lower rates of smokers among COVID-19 cases has been more recently described elsewhere in a rapid review of 28 studies on smoking COVID-19 patients from various countries. The authors of the French study suggest the mechanism behind the protective effects of smoking could be found in nicotine. This is something that seems pretty apparent to me. Again, they're saying the same thing, that the virus that causes COVID-19 gains entry into the human cells by latching on to protein receptors called ACE2, which are found, or ACE2, which are found in certain cells' surfaces. The researchers had proposed that nicotine attaches to the ACE2 receptors, thereby preventing the virus from attaching and potentially reducing the amount of virus that can get into a person's lung cells. That one to me seems to be the most likely explanation. It's one I support. It seems like the research that I've done suggests that's exactly what's happening. But there's something else here. Do we have to go with nicotine? A natural quit smoking remedy more effective than nicotine replacement. Again, this tells you a little bit about the drug industry. This new one called Sista Dean was derived from a natural plant, mostly in Eastern Europe. And if you're looking for a nicotine replacement therapy, it's sold in Canada and it's sold in Eastern Europe. But the Canada is under the name Crave, C-R-A-V-V. And I think they're out maybe because of this. But that they did trials with this and found that it was, I think, twice as effective as nicotine replacement therapy, and it was about 1/10 the cost of nicotine replacement therapy. Again, the drug companies can't be happy about that. But what this said is that placebo-controlled trials showed that Sista Dean almost doubles the chances of being smoke-free at 6 months. Okay, we wanted to see how effective cytisine was compared to a nicotine replacement therapy at helping smokers quit. Now, could this cytisine be an alkaloid that could work instead of nicotine to help reduce this? Well, there's a form of it. They use something called Ibuprofen Cytosine. Now, they found that cytisine alone doesn't do. This is a different disease. It's an autoimmune disease, again, going back to the notion that so much of this is inflammatory and an off-kilter immune system and central nervous system. Here you go. Central nervous system and inflammatory model. Okay. These are all related to the immune system and to the central nervous system being too keyed up and having nothing to sort of bring it down. Okay. It loses its regulation. Now, it's not specifically cytisine by itself, but this combination compound of ibuprofen octyl cytosine, okay? That, so the ibuprofen was moiety and cytosine as a nicotinic agonist. So cytosine is like nicotine, it attaches to the same receptors. I would love to see studies on cytosine and nicotine comparison to COVID-19 patients and to see if they can improve like a cytosine patch or pill. I think they have pills on that site. But I would love to see a study on that. Anyway, it said this particular one that combined these two functions in a compound reduced significantly by 70% disease severity inflammatory infiltrates in the spinal cord. 70% improved. That is astronomical. Again, it's a different disease, it's not COVID, but it's one that shares certain things in common. It's an autoimmune disease involving the central nervous system, involving dysregulation between the inflammatory aspects, that's where the ibuprofen comes from, and that ACE2 receptor, which is where the cytosine comes in. Combining those, it was proved to be a quite effective treatment to this. 70% is just an astronomical response. Again, another peer-reviewed publication in immunopharmacology. These are not fly-by-night publications here. We go forward. Cytisine, also known as baptitoxine or saphorin, is an alkaloid that occurs naturally in several parts, plant genera, such as, well, they call it about this, and has been used medically to help smoking cessation. Pharmaceutical companies, Tabex or desmoxin, cytisine have been used in Eastern Europe, available for the treatment of tobacco smoking. And I did look up the website of Crave, C-R-A-V-V. It's a Canadian company. They do sell these cytisine pills as nicotine replacement. So if you're looking to quit smoking and you're a current smoker, and it's approved for that, and I guess at that point you would just have a serendipitous effect of protectant against COVID-19 if that were the case. I would never recommend anyone go out and buy Crave just as a protectant against COVID-19, simply because it hasn't been studied and because I don't give medical advice. But it seems to have the nicotinic receptors very much the same, and it's naturally derived. And it has been more effective than nicotine replacement therapy over a shorter period of time, only 25 days versus something like 6 to 8 weeks. So, so that's all interesting, and it's a tenth the price. So again, this is how arming yourself with knowledge and really sticking with scientific research in a comprehensive way can help. Moving on, this is from New Scientist again, talking about, can breathing exercise really help protect you from COVID-19? One of the things I found most remarkable about the effectiveness of recovery from COVID-19 was those that engaged in breathing exercises did much better than those that were on ventilations. And I had to ask myself the question, why? I have a theory about that, and my theory is simply that breathing exercises really helps with the central nervous system. You engage the mind, you're literally intending this. And deep breathing has already been shown to limit anxiety and to bring down those keyed up emotions which jack up the sympathetic nervous system and aids the parasympathetic response through mental training combined with the breath. So it makes perfect sense to me. And it could help deal with fear and all the things that fear is sending into your system. So it makes perfect sense to me that breathing and mind-body training would have a tremendous palliative or helpful effect in creating, again, that equilibrium, that healthy equilibrium. Let's see what this has to say. It says, the exercise is similar to others used in respiratory care. Deep breaths are generally a good idea because they encourage air into the depths of the lungs. If these pockets of the lungs aren't used, they can essentially close and become at risk of infection. Okay, so there's a physical reason for it. But again, they're not mentioning what I think is the primarily important reason of helping to create a buffer and a counter to this inflammatory response, both in the parasympathetic, but also in your immune response. Deep breaths can also increase the amount of oxygen getting into the body and the volume of carbon dioxide leaving. So again, more physical reasons for it, but I think some of the most important reasons have to do with the emotional effect. I'm just including this. I'm not going to go ahead and play it by any means, but here's a YouTube channel about a COVID-19 patient who did, in fact, use breathing exercises and gives a very, it's only 4 minutes long, just a very nice little snapshot of it. I'm not going to play it. You have it there. I will also provide the link if you would like to look at it. More scientific papers here. The effect of mind-body training on cytokines. Cytokines, remember, are those things in blood that crank things up, that get triggered when you have an infection or get triggered oftentimes in other kinds of stressors as well. Conclusion here is that mind-body training may increase IL-10. Now, I'll tell you what that is. Under specific situations, such as a decrease of pro-inflammatory cytokines, which may regulate the stress response and possibly contribute to effective and beneficial interactions between the nervous and immune systems. There you go. They finally got to it. They said it may happen, and they had a very vague notion, okay? But again, decrease of pro-inflammatory cytokines, bringing down that cranked up response And here's the thing, effective and beneficial interactions between the nervous system and immune system. You're using your mind to send a signal to your brain and your spinal cord and your nerves, which are then sending messages to your towards your hormones and your glands, right? Which are creating elements, creating substances that are affecting your immune system and response. It all works together. It all works together. When you're keyed up on one side of your body, and if you don't have any way to modulate it, it starts dumping itself into other aspects of your body, creating obesity, creating heart disease, creating all these chronic wearing down of your mind, your body, your emotions, and so forth. When you can begin to reverse that by using effective, especially internal processes, you can create a holistic reversal of that. That's why diet's so important. That's why your affect is so important. Your relationships are so important, because those directly affect your nervous system and therefore your blood and your immune system and ultimately your breathing as well. We can go from both ways. We can do breathing to help calm our mind and use our mind to help create better breathing or create these other things. They can work together. Here's another one from a peer-reviewed publication called Inflammatory Cytokines and Immune System Modulation by Aerobic versus Resisted Exercise Training for Elderly. Again, one of the big downsides to the way in which this has been done, no one is saying go outside, one, to get your vitamin D, as we saw in the other one, which is really important. You need it, sunlight, to get your vitamin D. It's critical for COVID-19. And two, exercise. You need to get out and you need to do exercise. Exercise also creates this modulation and this balancing. Both aerobic and resistance training is critical. I don't think you have to put one against the other. They both help in their own ways. So, cholinergic modulation of the immune system presents new approaches for treating inflammation. Cholinergic, again, has to do with that nicotine receptor, the cytosine, but also being able to stimulate this sense of modulation and balance by other methods, including mind-body training, deep breathing, and other things as well. We could do, if you want, send me a message, to do a more comprehensive survey of all the ways to bring our immune system into greater alignment and our cranked up, stress-ridden lives into more of this. I know certain things, I know for myself personally, that omega-3s are critical for that. Again, not recommending you take them, but for me personally, they have been helpful. Now that I'm vegan, I'm taking omega-3s in flaxseed and also the algal form, which is the long chain form, and it helps to modulate mood, and research shows that, because it's modulating some of the chemistry in your body to be more calm, to be more balanced. When people have too many omega-6 fatty acids, they get much more cranked up and much more agitated. So again, that's another example where this modulation comes into play. What is a cholinergic response or cholinergic system? It's the parasympathetic nervous system, like I said before, which uses acetylcholine. That's why they call it cholinergic. That's the last part of acetylcholine. Almost exclusively to send its messages. Is said to be almost entirely cholinergic. Okay, so acetylcholine, parasympathetic, bring you down to relaxation. Neuromuscular junctions. Okay, just talks about sweat glands being cholinergic, sympathetic nervous system. It's a parasympathetic nervous system, but it links up with neurons in the sympathetic nervous system, again, to help raise them. Your forebrain, brainstem complexes as well. So it's not a small thing. And again, the receptor, that nicotinic acetylcholine receptor, the reason why nicotine works is because it's going in this acetylcholine receptor, the same place that the virus goes in and displaces it. So it doesn't do what the virus wants it to do, which is to replicate and to cause real harm to your body. It kind of prevents that from happening, or at least slows the rate of that happening, thus helping the body to recover faster. Now, what is a cytokine storm? Okay. And this is important because I've also talked about vaccines and how they don't distinguish between a non-beneficial, inflammatory, over-inflammatory response of the immune system, and one that actually helps go right at and neutralize the antibodies. And this actually proves it here. Look at what it says here. Well, for decades, common thinking suggested that every immune response to antigenic invasion was always beneficial. And that's how they determine, quote, the efficacy of vaccines. Just a response. Any immune response or every immune response. Jack up the immune response, it's better. Turns out that's false. And we'll see why here. That was the common thinking for decades. And it was always beneficial in averting potential damage. Studies in the 1980s identified that immune cells produce proteins called pleiotropic properties, having the potential to be either beneficial or harmful. And that's a case that we're now understanding. And with so many chronic diseases and autoimmune diseases and inflammatory diseases and all those associated with that, diabetes, arthritis, obesity, and so forth, we're finding that to be the case. Your immune system doesn't react properly or in balance, it'll actually tear your body apart rather than help it. Okay, the proteins called cytokines or cytokines were found to cause clinical manifestations similar to sepsis, such as hemodynamic instability, fever, and localized inflammation. Again, too many cytokines, cytokine storm, you have inflammation, you have fever, you actually create a sickness, or you make bad sickness far worse. And that's what's happening with COVID-19 patients, oftentimes pushing them over into death. Their bodies just break. So cytokines are important in mediating both immune cell recruitment and complex intracellular signaling control mechanisms that characterize inflammation and infection control. They are expressed by numerous cells, including macrophages, monocytes, B and T cells, all the cells of your immune system. Again, here's important. While activation of the immune system is important in fighting pathogens, dysregulation of cytokine production may lead to uncontrolled effects that can ultimately be detrimental to health. I'm going to repeat that. While activation of the immune system, hello vaccine companies, is important to fighting pathogens, you don't activate them, they don't come to the proteins, you become infected, they multiply, that's not good. But dysregulation and overreaction, right, of cytokine production leads to uncontrolled effects that can ultimately be detrimental to health. They can destroy the body and even, as I showed in these past videos, even actually make the disease worse and aid the virus in taking your body down. That's kind of what's happening here with the COVID one. It's usually, it's actually attaching to a system or signaling system, okay, that is creating an overproduction, overreactive immune response that's actually taking the body down and too often to a place where it's killing actual people. So this idea of more is better is turning out to be false. You need to distinguish between the kind of reaction that's helpful and effective and the kind of reaction that's not helpful, it's inflammatory. Because if you don't, then what ends up doing is that the actual cure can be worse than the disease. It's not a cure, it ends up being the factor that actually kills you rather than cures you. So this is about inflammatory cytokines, okay? There's two kinds of cytokines again. We're just going this over and over again. We have two types of antibodies, the good ones and the bad ones. We have two types of nervous system response. We have the sympathetic cranks you up and the parasympathetic that brings you down. And we have the same, we keep on having that in cytokines as well. We have inflammatory cytokines and anti-inflammatory cytokine. And they, again, they're meant to balance each other. Inflammatory cytokines, okay, is a type of signaling model that's secreted from immune cells, okay, and certain that promote inflammation. Again, it's a signal to your body that something's wrong in that part of you. And if you didn't have that signal, just like if you didn't have pain when you hit your foot on something, you'd be like, you'd be basically slapping, you have a bloody foot and you not even notice it. So a good functioning inflammatory immune response shows you by its pain, by the fact that it swells up and so there's something wrong here and it signals the rest of your body. That's good, but if it becomes over-inflammatory, okay, here's what happens, the negative impacts. Due to its pro-inflammatory action, a pro-inflammatory cytokine tends to make the disease itself or the symptoms correlated to a disease worse by causing fever, inflammation, tissue destruction. You see that with actual fevers. When people have to take, ibuprofen or they have to put cold compresses on it to bring it down, otherwise your body literally could burn up and die from being too hot. In some cases, even shock and death. So excessive amounts of pro-inflammatory cytokines have been shown to cause detrimental effects, as one would expect. So now we talk about anti-inflammatory cytokines. Okay, the other kind, again, one's not good or bad. They need each other, and your body needs them. The inflammatory cytokines to signal and attract attention to a possible problem, and the anti-inflammatory ones to come along to help the inflammatory ones recede to the background once they've done their job, because they're always cranked up. You don't have that and they keep going, or they come, if the response is too big, you start to destroy your body, you eat it basically from the inside. So here's the abstract. The anti-inflammatory cytokines are a series of immunoregulatory molecules that control the pro-inflammatory cytokine response, right? They come in to bring it down. Cytokines act in concert with specific cytokine inhibitors, okay, and receptors to regulate the human immune response. Their physiologic role in inflammation and pathologic role in systemic inflammatory states are increasingly recognized. Again, going back to those kids that got these multi-organ inflammation syndrome, that's what's happening. They're having a cytokine storm. And again, that cytokine storm we have already seen in those past videos can be related to coronavirus type vaccines, especially in Zika, HIV, coronaviruses, which includes COVID-19 and a couple of others. Dengue was one of the other ones, to the point where literally, if the person experiences that disease in the wild, that increased pro-inflammatory cytokine sort of introduction from that vaccine earlier on can actually accentuate the disease and make it far worse. That has to really be studied. We have to distinguish between an appropriate response and an overactive response. More is not better when it comes to things like inflammation. Okay, and here's an explanation of it. I shared this in the other video as well, but I'll repeat it. Those cytokines are beneficial in the initiation and coordination of immune responses. Unregulated cytokine signaling inadvertently constitutes principal determinants of immunopathology, giving rise to autoimmune disorders such as rheumatoid arthritis, as well as hypersensitivity reactions. Overactive immune systems are exactly what give rise to an autoimmune response, and oftentimes chronic autoimmune diseases, like Crohn's disease. In the other video, I've explained this, and I encourage you to go back to those. I'll try to make the link at the end of this one. Again, viral-induced enhanced disease illness. This is a repeat of one of the ones I used in one of my other videos, but it says, under certain circumstances, a viral infection or vaccination, this is key, may result in a subverted immune system, which may lead to an exacerbated illness. Clinical evidence of enhanced illness by pre-existing antibodies from vaccination. That's the key term. Clinical evidence of enhanced illness by pre-existing antibodies from vaccination. You get a vaccination, it may be good for dealing with that disease, but it brings about certain kind of antibodies that remain in your system and could, in the future, actually cause an overinflationary immune response that makes that new pandemic, new virus, far more dangerous and even deadly. We saw this in that other video when we saw the increase of flu vaccination going up among elderly, and the death rate went up as well. Now, it wasn't expected because they were thinking, well, gosh, we have good immune response, because the research did not distinguish, and of course the industry has no incentive profit-wise to distinguish between a pro-inflammatory response and an anti-inflammatory immune response. And that was the problem. And now they don't have any liability or accountability because they passed laws, they bought politicians to pass laws so that they don't have to do this research. But you should be informed in that. You will have a risk that's been established. Look at my other thing, my other video. You will have a risk of an increased response, inflammatory and deadly response from certain kinds of immunizations. You can have it, not necessarily will. I explained the times when it might be, I'm a middle vaxxer, not a pro-vaxxer or an anti-vaxxer. I've even explained the times when it might be beneficial to take something. But I've always counseled, look at adjuvants, look at the preservatives, look at the materials in there. Are they foreign proteins? and find the ones that have the greatest safety and the greatest tests around them if you are going to take them, because these oftentimes don't make that distinction. And if it sets you up for a greater deadly response in the future, that's not a solution. I showed in that other, this is from learntherisks.org. You can see it right up here in the corner. What's in a vaccine? Adjuvants like aluminum. Oftentimes getting that pro-inflammatory response, creating antibodies that could come in a future pandemic and actually make the disease worse. We need to do studies on that. And the CDC itself says if you are allergic to anything in a vaccine, I showed that in my previous video, you have a medical reason not to take it. So I encourage people who feel as if this vaccine and the ingredients could be damaging to you to get skin tests to see if they are allergic to any of them, and if necessary, to refuse to take it on a medical reason. Again, I'm not recommending you do this. I'm not anti-vax in this way. What I am pro, do your own research, understand the risks, see how your body reacts to something, integrate the research so you can see what the relative benefits and the harms are. But if the harms are significantly more than the benefits, I would say it would be logical not to do something that would seem to be on balance worse for you than better for you. So again, do your own research on this. Here is the mechanisms and actions of adjuvants. This is, again, a little bit of a throwback, but I just wanted to go ahead and highlight this. Adjuvants can create memory in your immune system and antibodies in your immune system that can stimulate an inflammatory response to future diseases that can damage your body or make your body less capable than people who have not had vaccines. I don't, again, recommend for or against these. I have said again, I'm a middle vaxxer. Research them, research the relative benefits and risks, and make your own decision in consultation with people that you trust. I'm just a guy at a video. I brought this stuff together. I'm doing it as broadly and as balanced as I can, but I'm just one person. So again, here goes. Surprisingly, despite the wide use of vaccine adjuvants in billions of doses of human and animal vaccines, the mechanism of action by which they potentiate immune responses are not well characterized. They haven't studied the response itself, even with billions of doses. This is well captured in a famous quote by Janeway, who observed that adjuvants are, quote, this is a quote, the immunologist's dirty little secret. Okay? You could throw junk in there to get your immune system to respond. Of course it's going to respond. It's trying to fight against the things that are foreign. Just because you provoke an immune response is no better than provoking a fight. You have to provoke it for the right reasons and in the right way. Okay? You know, if someone is harming your child, yeah, go out and fight. If you're just sitting at a bar, you know, all full of yourself, not a good reason. And probably not a good method associated with it. The same is true of so-called invading antibodies. If we keep our health in a good situation, we can develop a cooperative relationship with most viruses and bacteria. Some of them are uncomfortable, but it takes our body time to learn. And this is why I've even supported well-developed, safe vaccines that are small batch, that don't have all this junk in them, because they can actually train your body. It's called immune therapy, and how to learn to deal with a foreign virus. I've also recommended in another video, I wouldn't even say recommended, I put forth as a wise action, at least with regard to my own opinion, not in terms of recommendation for your action, some of the recommendations that Dr. Sears, Bob Sears, put out there in terms of not overloading your system, staggering out these vaccines if you're going to use them. Use the safest forms of them, the ones that are the best tested. Don't take all of them maybe that are recommended if it turns out that they aren't as necessary and if you may be allergic to some of those things. Again, it's about weighing these things. It's about not saying no or yes. For me, I'm hoping that this will help force on a market level and on awareness level safer vaccines. Vagus nerve stimulation is another thing that, again, it's been used to epilepsy, but again, vagus nerve using electrical impulses on the vagus nerve, okay? It's the one that comes basically on the side of your neck. You kind of see it here. To deal with things like, I believe it was epilepsy was one of them. But they're finding other uses for it because, again, it helps with the parasympathetic nervous system. When you're keyed up, it also does what some of these others do, which is calm down parasympathetic nervous system. And then they talk about it, NVS, or vagus nerve stimulation, as a therapeutic intervention. I'm going down here. Did I guess the part that I had outlined is not there, but that's okay. I mean, they just do an overview of it. It's a good resource. But again, it shows you that you don't always need drugs. Sometimes you can do things like stimulation, and alternative therapies are warranted. I think that I've said this, at the beginning, so I won't necessarily go over it again. But again, let me just emphasize again. The three big enemies here are fear, ignorance, and opportunism. And the three ways we can address that is by engaging in their opposites. Courage, in response to fear, knowledge in response to ignorance, and care in response to opportunism. We need to do this across any kind of cultural divisions that we have. I've even talked about it in terms of the pro-choice and pro-life communities get together. Think about that very much the same way you would a balanced immune system. If we could have a holistic approach, for instance, to the abortion debate, we could be both pro-life and pro-choice, and everybody would be better off. If we had the same thing with regard to our immune systems or our health, we'd be pro-inflammatory, see the rights of that one, and also anti-inflammatory, see the importance of that one. I've talked about this in terms of the abortion debate. I said we all agree that we want to limit unwanted pregnancies. That would be the equivalent of limiting unwanted diseases. And we do that by education, right? We do that by supporting young girls and women in their self-esteem. We do that by supporting working mothers. We do that by supporting, healthcare and childcare, and alternatives to abortion. Nobody I know wants to actually increase the number of abortions. They feel forced into it for one reason or another. So we have an analogy here for our own health. Okay, we don't have to be anti-vax or pro-vax or anti-abortion or pro-abortion. We can be middle, which synthesizes the respect for life, whether it's abortion or whether it's our health, and respect for choice. That's our own empowerment, our own learning, our own engagement, and our own determination of our sovereignty and our autonomy and our choices going forward. You shouldn't have to put one against the other. You don't have to do it in health. You don't have to do it in the abortion debate either. We all have a stake in creating more choice and more life, both in our health and in cultural issues that divide us. Let's not let them divide us anymore. Let's not let them divide us into conspiracy community versus conventional media. Let's create a progressive, alternative, inclusive thing that brings in libertarians, conservatives, liberals, and progressives like myself. Let's have vegans work together with paleo people and people that have diets that they're not even understanding the effects it has. And let's take an experimental, investigative, and more comprehensive approach to that. And what we're going to find is that the truth actually emerges in this. You don't have to feel ashamed of being the person you are, liking the things you like. You don't have to be shamed for doing these or being who you are, okay? What you can do is say, this is where I am right now. These are the things I like, and here's a little bit of the genius or a little bit of the intelligence I can offer into the conversation. And I'm open to hearing from others as well. That's the mentality that I'm trying to get forward on citizenzeus.com. And again, if you have support for this, that mentality, this content, please consider donating at my website at citizenzeus.com, or on this YouTube website. There should be a link to PayPal in the corner there on my banner. And feel free to reach out to me at zeus@citizenzeus.com with other questions and or some research you might like to see explored. I'm very open to that, and I respond well to engagement. So again, thank you for stopping by, And I'm hoping we can all work together to create a better future and better health. Thank you very much.